Hello, everyone. This is Debunking the Internet Myths, Separating Medical Evidence and Facts from Fiction. In other words, separating the wheat from the chaff. What are the keys to solving chronic medical problems? Basically, it's first, detect the cause. What is the cause? Second, remove that cause. And third is repair the damage. We have a lot of climate change coming up. We have seen a lot of this in the TV and on news media, et cetera, all the different floods, et cetera. That means more mold growing in places. Here's mold growth in an existing structure behind walls. Here's underneath. This one is underneath wallpaper. This is while the house is being constructed. So just because it's a new house doesn't mean that it doesn't have mold. So let's start with the medical evidence and facts. This was published back in the late 1980s. You can see it down at the bottom. Spores of toxigenic fungi contain mycotoxins. And second, mycotoxins associated with spores are likely to be absorbed via the respiratory epithelium and translocated to other sites, producing systemic effects. Read, there is nothing about the gut here, okay? So, what are the neurological effects of mycotoxins from published studies? Autism spectrum disorder, decrease in short and long-term memory in adults as well as in children, optic neuritis, chronic inflammatory demyelinating polyneuropathy, also known as CIDP. That is where you get numbness and tingling, etc., in your arms and legs, especially the lower legs and the end of your arms. Guillain-Barré syndrome. ALS, also known as Lou Gehrig's disease, amyotrophic lateral sclerosis, Alzheimer's disease, multiple sclerosis, movement disorders, Parkinson's disease. Studies have shown that all of these can be caused by exposure to mycotoxins from toxic molds. Where do they, when the mycotoxins are in the body, where do they go first? Overwhelming medical and scientific evidence shows that it is the brain and nervous tissue. Okay, that's first. The second part is mycotoxin antibodies bind to human tissue, including neural tissue such as myelin, and triggers demyelination, loss of myelin. Here's evidence. It's from the study on different brain regions are infected with fungi and Alzheimer's disease. What else? ALS. This is amyotrophic lateral sclerosis. This is Lou Gehrig's disease. Again, compelling evidence for fungal infection. This is from a study that's down below. It's POTS, which is postural tachycardia syndrome, myalgic encephalomyelitis, as well as chronic fatigue syndrome, autoimmune disorders, and dysautonomia are linked to mycotoxins. Hashimoto's thyroiditis and mycotoxins. Anyone having Hashimoto's should be aware of this. Millions of people struggle with Hashimoto's, an autoimmune thyroid disease. They eat normal amounts of food and exercise regularly, yet keep gaining weight. Their thyroid levels are difficult to treat. This is because the cause are mycotoxins, not the thyroid. Once the treatment for the mycotoxins is complete, the Hashimoto's goes away. Mycotoxins are related to other chronic illnesses and autoimmunity in particular. So this is, again, the central and peripheral nervous system, which is the brain, arms, and legs, but also the glands of internal secretion, the thyroid. And mycotoxins can cause the development of autoimmune thyroid disease and type 1 diabetes. Mycotoxins may also be complicit in the manifestations of PCOS, polycystic ovary syndrome, and premature ovarian function and endometriosis, which can cause serious problems in conception and maintaining pregnancy. So this is all from the study that you see below. Altered testosterone reduced the efficiency of spermatogenesis, the formation of sperm. Reduced sperm motility. All these things may affecting men's ability, and testosterone comes from mycotoxins. How about neuropsychiatric symptoms and immune processes? And this is from this journal from Tufts University. And this includes autism spectrum disorder. And what is the implication? The information reviewed indicates that exposure to mold and mycotoxin can affect the nervous system directly or through immune cell activation, thus contributing to the neurobehavioral disorders such as autism. Autistic children are found. Here's a study of 172 autistic children with 61 controls. In other words, other children without autism. And showed antibodies to mycotoxins. They measured antibodies to mycotoxins in both groups. The autism group showed elevated serum antibodies to mycotoxins. Okay, this as the last line, implicating mycotoxins as causing autism spectrum disorder. What about breast implants? Here's your breast implants. On the left is how it should look. On the right, what do you think that is in there, in that implant? Obviously, this is molds. Here is SIBO, okay? So all you getting treated for SIBO, this person, and she took these pictures, okay? And you can read what she wrote. So she started treatment on June 10th, and by September 12th, 3 months later, look at her. Look at the difference. Rheumatoid arthritis, an autoimmune disorder. These are two mycotoxins that are measured in serum and blood, not urine, increase the severity of rheumatoid arthritis. Okay. Here is a gentleman. You can see his skin on the left picture, his upper arm, and on the right picture, it's his abdomen and chest. But notice his finger, the ring finger. You see how swollen that is? That's rheumatoid arthritis with psoriasis. This is psoriatic arthritis. Look at him after 6 months of treatment for mycotoxins. Can you see the difference? Obvious. Multiple sclerosis. This was a study done that gliotoxin in the blood, the antibodies gliotoxin in blood serum has been shown to affect and damage microglia, astrocytes, and oligodendrocytes. Gliotoxin is a mycotoxin that is a neurotoxin. Folks, pay attention, please. Do not use glutathione or NAC if your blood test shows that you have gliotoxin. And here's a study, 3 studies that are listed down below. One of them is I'm the lead author. Study demonstrated the mycotoxin gliotoxin causes demyelination, leading to multiple sclerosis. Rutgers Medical School published a study that stated, we propose here that fungal toxins are the underlying cause of multiple sclerosis. All right, so let's look at cancer, 35 different cancers. This journal analyzed pan-cancer analysis, revealed cancer type-specific fungal ecologies and bacteriome interactions. It was published 2 years ago in the journal Cell. What did they find in 17,401 patients with 35 different cancers? They had tissue, blood, and serum samples, okay? Fungi were found in individual tumor types and contribute to the carcinogenesis, in other words, the development of cancer in esophageal, pancreatic, breast, lung, melanoma, ovary, colon, brain, and bone. That's cancer and mold, toxic molds and mycotoxins. Look at the left two pictures. This is on a person's forehead. You can see this huge cancer growing, and 59 days later with treatment with itraconazole, look where it is, much, much better. What about the safety of itraconazole? Because on Dr. Google, there's all these stories about how your eyeballs are going to fall out and all your teeth are going to fall out and God knows what. So what do they say? What does medical and scientific evidence and facts say about itraconazole? Read the last two lines. Itraconazole has been well tolerated with doses of up to 400 milligrams per day, being generally free of serious adverse effects. And there's the study. Now, let's go to debunking the great myth, urine versus serum. This is what is gotten from medical science, not Dr. Google. Low levels of mycotoxins are found in a lot of foods, cereal, beans, fruit. Remember, beans, coffee are beans, etc. And this is admitted freely by the World Health Organization, the United Nations Food and Agricultural Organization. For that reason, you can find always a little bit of mycotoxin in the urine in ppb, parts per billion, which the body just excretes rapidly. So food mycotoxins are not a concern. Why? Because the amounts of mycotoxin tested in foods have been shown in numerous studies to be below tolerable daily intake, TDI, set by the FDA, the European Food Safety Authority, and the UN Food and Agriculture Organization and the World Health Organization Joint Expert Committee on Food Additives. So what is the difference between a urine test and a blood test for mycotoxins? This is serum blood testing is highly accurate and tells you if you have mycotoxins from toxic molds from a contaminated indoor environment. Urine measures what's left the body, not what's in the body. It's what left the body and changes daily because it measures mycotoxins that are being excreted that you got from food, not from your indoor environment, and it can change day to day, week to week. So what does the latest study, this was published 2 years ago, comparing the two studies, the variability of mycotoxin concentration in urine and its volume based on daily intake demands urine sampling at different time points during the day. And then because of what's underlined, because various factors such as gender, age, diet, muscle mass can influence creatinine secretion. So they're saying it's not an accurate test. Now, what do they say about the blood test? The ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. Again, that's the study down below. What is that what lab does this accurate test? That's so precise. MyMycoLab. It gives you both IgG, which is a toxic reaction, and IgE, which is a mast cell activation measurements for each of 14 different mycotoxins. And it's available internationally. Let's take debunking of useless and dubious tests. This is a partial list, and we're going to go through these. So this MMP-9 HLA-DR myth about your genes, TGF-beta, MSH, VEGF, visual contrast test, Marcons. Sorry. VEGF is a major player in leukemias and lymphomas cancer. Nothing to do with mycotoxins or toxic molds. Visual contrast tests, there's no test studies, not a single one. And the over 20 million studies in the National Library of Medicine linking this to mycotoxins. Mark-ons, there's not one study that it even exists in medicine. It's a fake diagnosis, fake test, and fake treatment. What does a high MMP9 indicate? Pancreatic cancer and cardiovascular mortality in patients with arteriosclerosis. What does a high TGF-beta mean? It means that you have impaired lung development and enlarged airway space. What does a low MSH mean? That you have lighter skin, hair, eye color, increased appetite and weight gain, a weakened immune system, and changes in mood. None have anything to do with molds or mycotoxins. What else? Another sham test. This is that famous HLA-DR, who they say affects 25% of the population. Well, 25% of the US population is 82.5 million Americans that are supposed to be affected by this, right? How come there's no published studies relating HLA-DR to anything with molds, mycotoxins, or the immune system? There's no research. It's not taught in any medical institution and has no basis in medical science, not one article. But here's another one. NeuroQuant. This is a test for brain atrophy. What? That means Alzheimer and brain trauma. If you really want a good test for the brain, do a SPECT scan. And as I said before, Mark-ons, there's no evidence in medicine to support Mark-ons diagnosis, testing, and treatment. This is not recognized in medicine. What about organic acid test, OAT, and gut health? This is from this study. Several popular organic acid tests claim to detect imbalances in gut bacteria and fungi, but most of the microbial markers on these tests do not measure what they claim to. Chemical antibodies in blood versus chemical presence in urine. Many labs focus on the levels of chemicals measured in urine, but this is an indication of chemicals that have already passed out of the body. We should measure the immune response to chemicals, emphasizing the importance of new antigen formation and chemical body burden, not what's left the body. It's a blood test. Practitioners can thus examine the role of chemical-induced new antigen formation in the development of autoimmunity. Here's a study on this GI map that's so popular. Look at how specific this whole slide is from Dr. Vajdaani, who read the study and did this slide. In the GI map, the specificity is 26%. What does that mean? That 74% is wrong. It's not a good test. Don't use it. Forget the GI map. Look for body burden of chemicals, not chemicals coming out of my urine. Mycotoxin antibodies, not mycotoxins in urine. Debunking useless treatments. The big medical myth, big delusion. Let's look at binders. Here's what a study shows. Binders rely on the absorption of mycotoxins from the gut, preventing it from getting into the bloodstream. And included are all these different binders, kaolinite, clays, activated charcoal, zeolite, etc. They're effective in neutralizing aflatoxins. They are ineffective in all other mycotoxins, and in addition, they also bind vital vitamins as well as macro and micro elements such as zinc, magnesium, etc. And folks, they're effective only in aflatoxin, which is not found in indoor contaminated areas. This was published. What's another study? Some physical strategies, such as application of adsorption agents, binders, presented no sufficient effect against mycotoxins. So let's look about food. How much food do you have to consume in order to have a reaction? Look at the last three lines. Well, for the first line, to illustrate a worst case acute exposure, the amount of oat flakes or wheat bread a person would have to reach, etc. So look at the last three lines. An adult with a body weight of 170 pounds would have to consume 28 ounces of oat flakes, corresponding to about 14 pounds of oatmeal at one sitting. Okay, or 19 ounces a week, corresponding to 28 ounces of bread. In other words, 20 slices of bread. So forget food, folks. It doesn't exist. Here's debunking Lyme, Babesia, Bartonella, Borrelia, EBV, etc. And this is what I get from patients. Oh, I also have Lyme, EBV, CMV, heavy metals, etc. If you're positive for mycotoxin antibodies, the above tests, Lyme, EBV, etc., will cross-react. The test will be positive, but you don't have the disease. Don't fall for prescribing medications and supplements because of a test result. Treat a patient, not a test result. I wrote about this in a study that was published 5 years ago, Lyme disease and mycotoxicosis, how to differentiate between the two. It was published in a medical journal. How about Lyme? Okay, diagnostic evaluation, and this is a study published. It's a big study. Both IgG and IgM antibodies to Borrelia, Lyme, can persist for several years despite a clinically healed infection. So if your doctor tests you again after treatment and it's still positive, it's going to be positive for several years. Okay, what about this post-treatment Lyme disease treatment and syndrome? The putative therapeutic benefits of antibiotics for patients with persistent non-specific symptoms after a correct or incorrect diagnosis for chronic Lyme, patients with so-called post-treatment Lyme disease syndrome was studied. They actually looked at this study. Findings from those microbiologic studies are substantiated by 5 clinical trials in the United States and Europe. And these failed to show any sustained amelioration or improvement with additional antimicrobial, in other words, additional antibiotic drug therapy. It didn't help. And this was published when? Last year. Okay. So Lyme disease, there's 5 million Lyme tests ordered annually. Excuse me, but there's only about 300 new cases, less than 10% of that. Most of these tests are ordered with very low positive predictive value. They're just ordered because, oh, you have chronic fatigue syndrome, fibromyalgia, or you're not feeling well, let's do a Lyme test. Patients may have a positive Lyme test due to cross-reactivity from other infectious or inflammatory diseases, or previously treated Lyme disease, which is what I said earlier back here when I said that you will cross-react, but you don't have the disease, okay? Many clinicians look for co-infections with Babesia, Bartonella, etc., but fail to look for mycotoxins. This was published from us in a study. So chronic atypical symptoms and post-treatment Lyme disease syndrome. No lasting improvement was found in any trial. No benefit was found with respect to either 2 endpoints, fatigue and quality of life. It didn't change by giving more and continued treatment with antibiotics. And what tests are unsuitable? Look at these. polymerase chain reaction. PCR testing in serum or urine, forget it. The ELISpot, forget it. It doesn't work. The antigen detection in body fluids doesn't work. It is not suitable. The visual contrast sensitivity test that I mentioned before, not suitable. That CD57 positive, not suitable. None of these are suitable for the diagnosis of Lyme. Debunking supplements and ERMI. So here we go, folks. Recent study showed, was published a year ago, 11% of nearly 60 tested dietary supplements are actually contain an accurate amount of the key ingredients. 40% did not contain a detectable amount of ingredients at all. 40%. And so I have patients writing me that they're taking 20, 30, 40 or more supplements. Of course, they are sick. Not only are they sick, but they become very highly sensitive. And that's your sensitive patients. After a while, they can't tolerate anything or very, very few things. And this is why it's vitally important you do your homework before selecting supplements, as I have done for 35 years. The ERMI, this was published in August 2013, 11 years ago. It's not a test that should be done. And here's looking at what mycotoxins are found in HVAC, heating, ventilation, air conditioning ducts, refrigerator compressor, heating, ventilation, air conditioning, air filters, etc. Look at the first, the three columns at the top of aflatoxin, ochratoxin, and trichothecenes. Look at the aflatoxin. I told you it's not found indoors. There were none. A little bit of ochratoxin, but a lot of trichothecenes. So ochratoxin, aflatoxin, forget. Medical treatment based on medical evidence and facts. Here's what somebody wrote me. Past 12 months, I've been sharing the MyMycoLab website with all my mold remediation clients and recommending they do the MyMycoLab tests. I've learned so much from Dr. Campbell and so appreciative for the education and providing real solutions. I think it's finally having an impact with all the mold doctors who follow Shoemaker's useless binder protocol. I see many doctors, including Tom O'Brien, Jock Wilson, now discussing mold more and more. I think Shoemaker has single-handedly held up the health of many millions of people around the world. Dr. Campbell is unraveling the damages Shoemaker and his followers have caused. Here's another one. I've watched most of Dr. Campbell's webinars on the MyMycoLab's website for three times each. I'm a health coach and was working for a U.S. group that had a Shoemaker mold protocol, which was useless. I stopped health coaching at that program and focused on mold remediation in people's homes, as I think many of my sick clients had mold in their homes without realizing it. Here's what a young mother of a 3-year-old called last week and ordered her retest. She feels fantastic. Her 24/7 disequilibrium, loss of equilibrium, and vertigo are gone. She had it for 8 months before that. Her constant muscle spasm and numbness are gone. Her visual problems are gone, as well as lightheadedness, MS symptoms, and Parkinson's symptoms. She's sleeping better. Her mood is elevated. She is feeling like herself again. She found it horrifyingly amazing that all of the MRIs, neurologists, specialists had nothing to offer, yet something as simple as the treatment and targeted support from functional genomic analysis gave her life back. Wasn't that wonderful? Another one, just talked to another client, a man who was suicidal, overwhelmed, very ill, mold sick, fatigued, barely function, and not able to work. Now he is living the dream, working, feeling great, living life, ordering extra mycotoxin tests to share. He is extremely grateful, as am I. So first and foremost, the first rule of toxicology, get the patient away from the toxin or the toxin away from the patient. Otherwise, no treatment will work. Forget fluconazole. It only treats yeasts, baker's yeast, brewer's yeast, candida, etc. But it doesn't treat aspergillus, stachybotrys, penicillium, cladosporium, fusarium, or any of those. Itraconazole does all of them. If you have questions, email me, immunedoctor@gmail.com. Information on moles and mycotoxins with more than 106 references if you ask for it. You can also get these 2 studies. And I have more than 100 studies that are published: molds, mycotoxins, the brain, the gut, and misconceptions, Lyme disease and mycotoxins, how to differentiate between the 2. Watch my videos on MyMycoLab.com YouTube channel. And go to my website, Andrew Campbell. I'm sorry, it's AndrewCampbellMD.com, not AndrewCampbell.com. It's add an MD there. I'm sorry. So that's it, folks. I hope you enjoyed the debunking of all these fake things, and that you will take this to heart and do the right thing and get well in 6 months. That's all it takes. All righty. So take care and be well.